Researchers are looking into 100 reported cases of a neurological condition that may be linked to the Johnson & Johnson COVID-19 vaccine.
News 8 Now's Jordan Fremstad is here to explain why the numbers require some context. Jordan?
Anytime we hear the word warning, our sense of safety fades. However, researchers in the vaccine industry are required to report potential adverse reactions to stay transparent and make sure these vaccines are safe. Guillain-Barre syndrome is a serious disease, but even in this case, it's still rare.
In a world of information overflow, Dr. Raj Naik has to wade through complex medical information in a way we can all understand.
It's complicated.
Monday, the FDA released a warning after 100 people who got the J&J vaccine were diagnosed with Guillain-Barre syndrome, a rare neurological condition.
What we call an ascending paralysis, kind of starting at the feet and moving its way up.
The way these cases are reported matters. They come from the Vaccine Adverse Event Reporting System. This database allows anybody to report anything related to vaccines.
It is not something designed to show cause and effect.
Meaning just because someone develops Guillain-Barre syndrome does not mean the vaccine is the culprit.
There is risk all around us for several different things. Now, researchers are taking a look at those 100 cases of that neurological syndrome, but keep in mind, in the state of Wisconsin in 2019, 40,000 people were injured in car accidents, meaning, based on simple math, you have a better chance of ending up in the hospital from a car crash than you do from an adverse reaction from the Johnson & Johnson vaccine.
Mayo Clinic's Dr. Abhinash Virk says these 100 cases affected people within 2 weeks of receiving the shot.
For patients who are well beyond the 2 weeks of the Janssen vaccine, the risk is pretty much not there.
Even though these warnings create a lot of noise, no report at all would be louder.
If they didn't report these things, that would break our trust in the system.
Now, the cases have largely affected mostly men age 50 and older, and most people actually fully recover from this syndrome. And keep in mind, we're talking about 100 cases out of 13 million doses.
All right, some good information there. Thanks, Jordan. Doctors say they do encourage people to still get vaccinated because it is your best defense against the Delta variant.